New technology is saving the lives of women in West Michigan with more efficient ways of detecting breast cancer.
And News Channel 3's Jessica Harthorn tonight shares her own personal journey and shows us how 3D mammography works in tonight's special report.
Breast cancer is an ugly word in my family. My mother, Jan Cadleb, was first diagnosed at the age of 44. I was only 14 at the time, and the news was shocking, life-changing. So for the next 15 years, my mother battled this disease. 4 times it came back, and it finally took her life at the age of 59. Because of my family history, I decided that I wanted a mammogram at the age of 31, much sooner than most women. Early detection is everything, and tonight I'm going to show you new 3D mammography available to each and every woman in West Michigan, and exactly what you'll expect. As I walk down the hallway to the Bronson Center for Women, I'm excited but nervous about what this day will bring.
Hi, good morning.
I fill out insurance forms, and in minutes, radiologist Dr. Christina Jacobs makes me feel right at home.
Jessica?
Yes. Hello, I'm Dr. Jacobs.
So nice to meet you, yeah.
Before my mammogram, I wanted to ask Dr. Jacobs some tough questions, like what exactly causes breast cancer?
Maybe it's a gene that we don't know yet, or maybe it's multiple genetic factors and environmental factors.
Before my mother died, she was tested for the breast cancer gene. The results came back negative, so I thought that lowered the risk for me and my sister Cassidy.
The women with the BRCA gene, the breast cancer gene, that are diagnosed with breast cancer make up about 5% of our breast cancer patients.
So it's more likely for you to randomly
Right.
be diagnosed than to get it and have family history.
Right,
That's
exactly.
shocking.
It is, yes.
Then the door opens.
Hi. Hello. My name is Tess. I'm going to be doing your exam today.
I'm brought into another room where I'm asked to strip down from the waist up and put on a stylish gown.
So Jessica, is this your first mammogram?
It is.
Well, welcome.
I then sit for a little Q&A about my family's health history.
How many daughters do you have?
2.
Then it's time to get personal. Tess positions me in front of the machine.
Okay. I want you to turn your feet in straight. Good.
Both of my breasts were compressed, top to bottom and side to side.
Just keep your head up really high for me. Good. Go ahead and relax.
I'll be honest, ladies, it was uncomfortable, but it didn't hurt.
Jessica, you can put your gown on. I'm just going to review these.
Tess showed us the touchscreen technology, where after a tense 10 minutes, I decided to squeeze in a little joke.
I've never gone back to play with it, so.
What are you talking about? You play with boobs every day.
That is true.
As I get dressed, Tess explains the 3D mammography took pictures of my breast tissue, like slices of a loaf of bread.
Because you are kind of on the young side for mammograms, however, because of the family history of the mother and stuff, they may recommend that you start coming every year, or they may say come back at 35.
Gotcha.
Okay?
Thank you.
You're welcome.
Back in the waiting room, my mind starts racing.
So right now I'm waiting for Dr. Jacobs to come back and get me to show my results. I have to admit I'm a little nervous. Depending on what she finds, I'm told they may recommend I get a breast ultrasound, so we'll have to wait and see.
That's when Tess walks through the door.
So Dr. Jacobs is ready to see you.
And tonight at 11 on News Channel 3, I'll reveal the interesting results of my mammogram and some shocking statistics about the overall breast health of women right here in Kalamazoo County. I also asked Dr. Jacobs what symptoms we should all be looking out for. Jessica Harthorn, News Channel 3.
So Dr. Jacobs is ready to see you.
The time has come to learn the results of my first mammogram. Just minutes ago, I was introduced to tomosynthesis, otherwise known as 3D mammography. My technician Tess positioned me in front of the machine.
Okay, I want you to turn your feet in straight. Good.
And both of my breasts were compressed, top to bottom, and then side to side.
Just keep your head up really high for me. Good, go ahead and relax.
I'll be honest, ladies, it was uncomfortable, but it didn't hurt.
Jessica, you can put your gown on. I'm just going to review these.
As I walk to meet my radiologist, Dr. Christina Jacobs, I think about my own mother, Jan, who back in 1998 was given a grim diagnosis. She had stage 2 breast cancer. I was wondering how she was feeling that day.
Let's have a seat, Jessica. I'm going to show you your mammogram.
The images are astonishing.
Wow.
So you can see as it goes through, different things, different structures come into focus depending on what level in the breast we're in.
That's amazing.
According to Susan G. Coleman, fewer than 5% of breast cancers occur in women under the age of 40. However, breast cancer is the leading cause of cancer death among women ages 20 to 59. Women who are diagnosed at younger ages may have a gene mutation called BRCA1 or BRCA2. My mother tested negative for that gene, but Dr. Jacobs says I'm still on the border of having a high risk of breast cancer.
And that's a 20% chance that I could be diagnosed in my lifetime?
Right.
Wow.
Average risk is less than 15%.
The news is unsettling.
Earlier you had mentioned that anything white could be cancerous. So how do you determine what's cancerous and what's not?
Could be looking for a mass, so something that forms borders. We look for calcium deposits, which show up as these bright little tiny white punctate spots.
Dr. Jacobs also looks to make sure that no breast tissue is being pulled to a certain point. After a tense 5 minutes of looking over the images, I had to break the silence.
And you're not finding any abnormalities?
Nope, not at all.
Well, that's great news.
Yeah.
Go ahead and relax.
However, even at the age of 31, Dr. Jacobs says because of my family history, I need a mammogram every year. With my own 2 daughters, Lily and Grace, to think about, just a few minutes of discomfort is well worth a lifetime of memories with my family.
Thank you so much,
Okay.
Dr. Jacobs.
Sure.
I appreciate it.
Dr. Jacobs tells me that 3D mammography will eventually become the standard. The Bronson Center for Women is even expanding to accommodate the new machines. And here's something to consider, ladies. Coverage of mammograms for breast cancer screening is mandated by the Affordable Care Act. Jessica Harthorn, News Channel 3.